This meeting is being recorded.
Is it working? Can you hear me? It should be working. Um, but the video is working.
Oh, can you hear me?
Yes, now we're on. Okay,
Oh,
great.
okay. You,
I'll
you
just
can hear me.
turn off my video and sound for the next 6 minutes, and then as people
Okay.
start to, you can do the same. As people start to enter in, we can
Right.
yeah. All right, I'll see you soon.
Yeah. See you soon. Okay. Bye-bye.
Can you unmute yourself? Hi.
How are you?
Good. Can you hear me all right?
Yes, absolutely.
Awesome.
Nice to meet you.
You too. I'm just gonna let Dr. Kanayama in.
Absolutely.
Unmute. All right. We've got 8 people already waiting, which is cool.
All right.
I'm just gonna change my view so that we can, so that I don't get overwhelmed once everyone's in it. So many little screens.
Absolutely.
Oh, Dr. K is he there? Ah.
Good.
Can you hear us? Hi.
Yeah. Hi. How are
Hi.
you?
Good to see you.
Good to see you, Carissa. Can you hear me?
Yes.
I can hear you, yeah.
You can hear me. Okay, great.
So
Thank you so much.
hang on, let me see my view. Are you on a computer, Carissa?
I'm on an iPad.
Okay, so you can see everything okay?
Oh, yeah. Yeah, that's perfect. Yeah.
Okay, great. How are you feeling? You're
I'm well, thank you. Yeah, thank you so
feeling
much.
feeling ready to share your story as well?
Yes. Yeah. A little nervous, but yeah.
And that's probably good nerves because
Okay.
excitement, you know, like I can't wait for everyone to hear. I just got off the phone with Dr. K and yeah, just really, really looking forward to everyone being able to hear about your journey. And so I'm just going to start letting people in because there's already 10 people waiting. And then as more and more people enter, it's all being recorded. So they're going to get I'll cut this from when you start talking, and then they're going to get a copy of this recording. But I'm just going to give them a few housekeeping rules, like basically stay on mute. You can turn on your camera if you want, but just stay on mute. And then they have, do you see a chat, a chat feature on the side? Because then they can, yeah, so they can write their questions. It's not guaranteed that we'll have time to answer them, but depending on how we go with time, we'll probably only get to answer 3. So
Okay. Yeah.
does that
That's
sound
great.
good? And then I'll introduce you, I'll introduce Dr. K, and then I'll hand the floor over to you to share your story. And then
Cool.
you and Dr. K can kind of discuss and share the facts about what happened. And then we'll do the short Q&A, and then we'll close with, you know, I just want to say, you know, excision surgery is the gold standard to treatment. Make sure you see someone who is an excision specialist that does haptic excision and manual excision. And, you know, it's great that you do that, but post-op, there are so many other things that you can do, including diet, lifestyle, this and that. See someone who's qualified to address your endo symptoms, basically. And that's it. And then they'll get a recording. So
Perfect.
are we good to go?
Yeah, sounds good.
I did have one question. We kind of like, you said like the kind of the bullet points of like talking points.
Yeah.
Did you want that to feel more conversational? Like, do you want to kind of ask me each piece, or do you want me to just kind of like go through?
I think that I'm happy for you to just share your story as is, touching on those points that we spoke about in your voice notes. But
Cool,
yeah,
perfect.
just really wanted you to emphasize on the so people can see a massive contrast between your experience with the Da Vinci and the Dr. K surgery. Sorry, I'm just taking a quick.
Absolutely.
All right, cool. I'm gonna admit everybody, there are 16 people and we've got 42 sign-ups, so that's pretty amazing.
All right, that's awesome.
Yeah. All right, I'm gonna let people in now. It'll take a minute as everybody gets let in. And it should automatically mute everyone. Hang on, there's just letting more people in. All right, so we've already got 20 people joining us now, so we might as well just get started
Wow.
and get the ball rolling. Welcome everybody. Feel free to, sorry, we're just getting rolling, people requesting to enter, so I'm just letting them in as they request. But yes, welcome everybody. Feel free to turn on your videos if you want, but I'm just going to request that you keep your audio muted so that when we speak, we can keep the background noise down. So I don't know where in the world you are at the moment, so good morning or good evening. Dr. K, you're not in New York at the moment, are you?
No, I'm in Boston.
You're in Boston. And Carissa, where are you?
Yeah, I'm about an hour outside of Austin, Texas.
Okay, okay,
Yeah.
cool. So hang on just one second. Okay, cool. All right. So welcome everybody. Just a few housekeeping pointers here. Just keep your, again, if you just joined, just keep your audio muted and feel free to turn on your video if you want. We are going to do a short Q&A at the end. So if you'd like to submit a question, use the little chat feature and type your question in there. It's not guaranteed that we'll be able to get through all the questions though because of time restraints, but in saying that, let's just get the ball rolling. So I'm so excited that we can do this. It is, yeah, it's great that we're doing this for Endometriosis Awareness Month. And I'd just like to introduce you. This is Carissa. Carissa Floyd is a mom of one. She's 32 years old. She's a Pilates extraordinaire. She's based in Texas, and she has an incredible and very inspirational story to share with all of us today about her endo journey and her surgeries as well. And we are also joined, we also have Dr. Kanayama here from New York Endometriosis, who is a very, very seasoned expert in endometriosis excision surgery. He's done several thousand, and he has his own very successful, unique approach to his excision surgery, which has to do with haptic manual excision. And if that's something that you're not familiar with, hopefully by the end of today's meeting, you will definitely know the difference about between surgical techniques. So as you know, there's a bunch of us here, and I just want to hand the mic over to Carissa, and yeah, take it away. Tell us about your endo journey.
Yeah, I didn't hear the word endometriosis from a doctor or healthcare provider, really of any kind, until about 7 years since my symptoms started. And that wasn't until I moved to this, small town in between Austin and San Antonio. And for the first time, I listed out all my symptoms to my doctor, which is always like a long list. And I think I was telling you, Kimberly, when we talked, like by the time I got to this point, I just said them so nonchalantly because I had just been told everything's fine for a really, really long time. So things like constant pelvic pain, GI issues, acne, extreme fatigue, nausea, and the pain just was getting worse and worse. It was very normal for me to wake up at 1 a.m., go throw up real quick, and come back to bed. So I'm listing all this out, and he was like, what? And he starts writing everything down and taking it seriously. And he was like, has anybody ever talked to you about endometriosis? I was like, no. I've Googled all my symptoms. That one seems to fit, but everyone has said I'm fine, so I don't really know. And he gave me so I am thankful to him because he is the first person to validate me and thinking that I had this thing, and lead me to eventually to Dr. Kanayama, which is amazing. But he gave me really, unfortunately, I'm finding standard advice, which was, okay, here are your options. We can determine if you have endo by doing laparoscopic surgery just to see if you have it. And I wasn't super interested in surgery just to see without like fixing it at the same time. He was like, we can go on birth control. or you can try to get pregnant. And those were my options. Loved my child, didn't want to have another one, and I couldn't envision being pregnant in that state. Like just my capacity was so small. And that was, proposed as a solution to endo. I went on 3 months of trying a birth control that was awful, and I felt horrible. It was just awful. My body did not respond well to it at all. I started taking antidepressant medication for the first time in my adult life. Since past that, and I would continue to be on that for the next 2 years, basically. After that, during that 3-month period of, well, let's just try and see. My husband was like, you need to tell him you're not well. Like, this medication is not and having somebody outside of myself see that was really helpful. So I went back and I'm like, hey, I need a different solution. I still have pelvic pain, so it's not helping my endo. And also now I have this whole other list of symptoms that I didn't have before birth control. And so he was like, yeah, let's try another one. I was like, okay. I literally said, it feels like we're playing Russian roulette with my hormones. Is it possible to test my hormone levels, see where I'm at, and then prescribe me birth control that's dosed and, based on maybe my estrogen's a little high, maybe this is low. Can you do that? He was like, I wish. And no one tested my hormones. I got no testing. I had, blood work for other things, but nothing related to endo or, any, care in that kind of way. And fast forward a little bit, I'll say the next year, my pain got more consistent. It used to be more intermittent, and then it expanded not just to my cycle, but to when I would ovulate. So now I'm having ovulation pain. I'm having pre-period pain. My period itself is awful. I'm really having about 1 to 1.5 good weeks a month, and the rest of the month I'm out of commission. I'm teaching virtual Pilates sessions in bed with a heating pad. I'm throwing up in between things. I'm a mess. I'm missing out on my life, being a mom, growing my business. And finally, I broke down to a friend and I was like, I don't know what to do. I can't live like this. Like, this is awful. And she also had endo and referred me to a really popular online endo group on Facebook. And through that group, I felt really seen for the first time. There was tons of women who were in my same situation, or female-born members who were really wondering, like, okay, there has to be another step. Like, I've been to the ER with pelvic pain. That's backdate, but that happened to me too. Like, multiple ER visits, and it's just an ovarian cyst. It's just gastritis. It's what's the other one? Diverticulitis, right? Like, treated for all these things I didn't have. Like, no one said I had endo. And so I'm in this group and it's all the same things, right? Like, I haven't been seen. I have been told to take birth control. And then they're like, okay, so then the standard is excision. Oh, you don't know where to get an excision surgeon? Here's our list. Here's our approved list. And this exists, in this group, but other groups, other Reddit forums, there are lots of different versions of, I guess I'll call them health influencers, who are like, hey, these are our approved places. The person who made that list was a nurse, a retired nurse. She was not a surgeon. She was not an endo expert. And anyways, I picked someone from that list. So I was really excited to find somebody about an hour away from me in Austin, who was supposedly an endo expert. He used the Da Vinci. He taught people how to use the Da Vinci. He was really well known in this Facebook groups. His reviews were amazing. He seemed to be the best of the best, and he happened to be an hour away from me. So went to that before I ever met.
Sorry.
No, that's fine.
This meeting is being recorded.
Sorry.
No, that's fine.
Sorry.
So that was the first, that she was very kind, very empathetic. And I was like, okay, I'm in the right spot. I did not meet my surgeon though until very close to my surgery date, with a Zoom consultation. It was very quick. I remember feeling like he was saying all the right things, but it felt like he had said the same thing 1,000 times before. Like it was like a script. That he didn't listen to anything I said. He didn't really answer my questions. He just was like, yep, we're gonna get it all out. And anyways, I had reservations about that, and I wish I would have listened to my gut in that moment, and I didn't. Then fast forward to surgery date. It was pretty rushed. Everything went longer than it should have in the morning, so I got there really early, and I didn't have surgery till about 1 p.m. So I'm hungry, I'm fasting still, and it was a cascade of things. I walked into this is not a big deal, but it was another gut check where like I walked into a room and it was completely brick wall. There was a light kind of dangling from the ceiling. There's no windows. It felt really bad, and I was like, oh, okay. I had also never had outpatient surgery, so I really didn't know what to expect out of this. Lots of things that came up in right before surgery, a shot that I needed that I didn't know I was going to need, lots of little things, conflicting information on pain for nausea, whether one would be good or bad, things on my neck for that or not. So it just felt very like it didn't feel good. And then after surgery, I was told that they got all of my endo. They found stage 1 endometriosis and they got it all out, all gone. And I cried because until I heard that, I still didn't fully believe that I had it. Just because I had been told for 7+ years I was fine, So I'm like, you start to think if you're crazy. Is this in my head? Am I just
relate to that?
yeah? It's like, oh, I can't handle pain very well, or I don't know. Like everyone deals with this. And so when I actually heard that they found it and they got it, it was just this huge, so emotional. I did have a really hard time waking up from that surgery. I was vomiting left and right. I could not go to the bathroom afterwards. And I do have other medical conditions that I take very seriously and I let them know of. One of those is Ehlers-Danlos syndrome. And so I can dislocate and sublux very easily. So being moved is, when I'm, under sedation, that needs to be done very carefully so that something isn't dislocated. And something was done to my ribs. I could not turn it at all. I had to buy a bidet. I couldn't turn to wipe myself. Like it was that bad. And I was released from the hospital. So I got out of surgery around 3, which from my surgery notes, my surgery was only about 45 minutes.
Sorry, can you repeat that?
Yeah, from my surgery was about 45 minutes.
Right.
Yeah. And then when sorry, I lost my train of thought. 45 minutes. Oh, so that I remember being awake around 3 p.m. and I was not released until the moment before that outpatient facility was about to close, so like 11:59 p.m. I tried that entire time to go to the bathroom and not throw up, and I didn't succeed in either of those. I was continually these two things. I was discharged. They wouldn't admit me to the hospital. I could not make it a 10-minute drive to our hotel without having to pull over and throw up. I was released with Tylenol 3, which I could not keep down. And I remember my husband waking me up in the morning, and it was like I never fully went to sleep. Like I was just in this pain daze, and I was just like, I can't believe I made it through the night. We went back to not to the hospital, to the doctor's office. Still didn't see my surgeon. Again, saw this OB who took my Foley out, made sure I was going to the bathroom, and then I was released. And I went back home. It was over an hour drive, which was hell. And the surgery was supposed to be, outpatient, you're good in 2 to 3 weeks to go back to work type of thing. I
Mm.
was on the couch, could not do anything for over a month. It
Wow.
was awful. I have a photo that says, when my husband helped document things for me. And day 5, my big win for the day was I was able to walk myself to the bathroom for the first time
Wow.
in 5 days.
Mm.
And again, I hadn't had an outpatient procedure. I was like, this is just what surgery is. Surgery is awful. And I had no idea. Even when I had my son, I had him vaginally, so I didn't have any of those. I didn't know any different. I was just like, surgery. Um, yeah. Oh, there was something else I was gonna say about the surgery date. But those were the big markers. And then I like to say, like, I recovered from the trauma of surgery over the next 3 months. I don't feel like my endo was ever gone. Some things were a little better. And also your first 3 cycles after surgery are just rough no matter, like best surgeon in the world here, Dr. Kanayama, those first 3 cycles can be rough. Like, you just had for me, I had my ovaries worked on. I had everything worked on. And so things moving through there is a little painful.
So did
your
your
first,
endo symptoms improve at all after that? Or
I
was
would say a little bit, and
Mhm.
it's really hard to tell. Like, I really feel in hindsight, I feel like I started feeling better from how awful I felt after surgery. It
Mm.
was not a night and
Mhm.
day difference pain level from pre-surgery. It was
Right.
just like, oh, like surgery just shot it up to like a level 100, right? And so then when it came down, I was like, oh, okay, I can, I
Mm.
feel some relief. Month 4 was kind of my sweet spot where I was like, okay, those first 3 cycles are over. I'm like feeling more like myself again. We took a 1-month vacation to Europe, which was amazing. And the very first part of it, I was on my cycle and I was on my period for 10 days. Every day I kept thinking it's going to end, and it didn't. And I was like, oh shit, it's back. Like, I just knew right away. I knew. And from there, it was a steep decline. My symptoms came back every month, worse and worse and worse. By October, I'm not functional. And I reached back out to my original surgeon, the nurse practitioner who had seen me that day, throughout my care, did a Zoom call with me so I didn't have to drive out to Austin, and I told her all my symptoms. She recommended pelvic floor therapy, which is amazing. And like, I've seen a lot of people do, like, if you need pelvic floor therapy is great, but this wasn't that, right? Like, this,
Mhm.
I knew I'm like, I am in debilitating pain. This is
Mhm.
not my pelvic floor. Like, I just know it.
Mhm.
Right.
And then she started crying on our call and she said, it sounds like it's back and that's really not fair. And I was like, yeah, I need help now. What are my next options? And my next options were another surgery like the first one, which that I really couldn't even fathom, or a hysterectomy. And at that time I was 30 or 31. Yeah, 30.
Um,
It was, yeah, it was a lot. And they also couldn't see me. So this was in October, and I'm at the point where I'm like, I can't go through another cycle like this. This
Mhm.
is pure hell. Like, yeah, I wouldn't wish it on anybody. It was really bad. Sorry.
Yeah.
mhm.
Yeah, it was really, really painful. Um, and their solution was like, well, you can maybe early 2023, maybe yeah, 2022, I guess. Yeah, it was October, maybe they could see me January, maybe February, and then schedule surgery. Like, I can't wait 2 months, 4 months, 6 months for this. I wrote him a message on the portal, and it's crazy to me now. I thanked him for all that he had done and tried to describe how dire of a situation I was in and to please see me sooner. Like, I just needed help.
Mhm.
And so they scheduled another virtual to meet with him at the end of November, but that meant I had to go through another cycle. I was like, I can't do it. In the meantime, I randomly am visiting my sister And on the side of the road in another town is an old friend who I have not seen in 10 years. I get out of my car and we just immediately hit it off. We pick right back up. Whatever. We get drinks that night and I'm like, hey, I think I'm getting a hysterectomy. Like, I'm 30 years old and how is this happening? Like, it's just crazy. She was like, hold on before you do that. So her sister had had surgery with Dr. Kanayama. Around the same time, I had had my first surgery in Austin, which was with the Vinci. And she was like, you need to go to New York to have surgery. I was like, that's insane. Who just goes to New York to have surgery? I can't do that. I can't afford it. I can't figure that. I have in so much pain. I'm shocked I'm here, like all that stuff. And she's like, no, you have to. And she immediately puts her sister on speakerphone. And her sister describes her surgery experience, which was night and day difference. And I will never forget it because her sister said, on day 5, I was able to do some light walking around in New York. We went shopping a little bit. And I was like, that's not real. No. Day 5, I could barely walk myself to the bathroom. And she was like, no, and she was like, I'm so sorry. That's not a normal experience. Like, she was the first person to help me realize that my surgery experience the first time, not a typical post-op.
Prior to this, you were telling yourself this is just what surgery is like.
Yeah. Just thanks. No one wants to have surgery. This is why it's so bad. And so, so that led me to, on a whim, I was like, okay, I'm going to call them. And they were able to get me in early November, which was, I'm mid-October. They got me in early November. I had a consult on a Monday with Dr. Kanayama, which was, he did the consult. He did my ultrasound. He did my pelvic exam. He talked me through every part of the ultrasound as he was going. He printed everything out. And then we talked through all of my symptoms, everything he saw in the ultrasound, plans to going forward right there. With, like, I have never had a surgeon do an ultrasound. I've been to ultrasound, imaging facilities where they just send it off and whatever. And I remember saying, well, I thought you couldn't see endo on an ultrasound. And Dr. Kanayama said, you can't, but a good surgeon can see the evidence of it. And I was like, mind blown. Why is everyone not doing this? Why are people not trained to look for this? An ultrasound is like the least invasive.
One comment. Can you hear me?
Yes.
Okay, I'm sorry. Yeah. So the reason why I'm doing ultrasound by myself is I'm really looking for very subtle sign of endometriosis. So, for example, you cannot really diagnose endometriosis by the ultrasound, but when surgeon like me, I really know endometriosis. How does it look like? How does it behave? Then do the scanning of the ultrasound. I can almost I can see like a crime scene. So ultrasound, I'm more like a detective, and I am going inside Carissa's body by the probe, and I am moving my probe. And sometimes you cannot diagnose adhesion until you do laparoscopy. But when you do ultrasound, when you move your uterus, ovary moves together with uterus. Then you can kind of see adhesion does exist. And also you can see many different positioning of, abnormal sign of the, endometriosis crime scene. So I have
love that.
I trusted the radiologist before, and they say everything is normal. Then patient come to me, I do my own ultrasound. It is not normal. So
and how many of us have had those normal ultrasounds whilst we were riddled with disease?
But it is not normal ultrasound. So.
Yeah, and that is and again, that's such an incredible skill. So are you implying that when you saw the ovaries moving with the uterus, that means that they were fused together via adhesions?
It's likely, yes. But it needs to be confirmed by the laparoscopy.
Yeah, so that was
But I can get a clue of what is really going on inside.
Yeah.
And that combined with my pelvic examination, that kind of really understand, I'm not inside her body, but I'm seeing through.
That's incredible. Yeah, so
Right.
that really solidified. Yeah. So the pelvic exam,
Mhm.
can you feel, sorry if this sounds really ignorant, but can you feel evidence of endo when you're doing a pelvic ultrasound?
It depends on the patient,
Yeah.
but I brought the Carissa chart.
Oh,
So I draw the picture in the end of my examination.
I remember
So
that.
because of I try to explain my patient. It's so three-dimensional. Everything shifted three-dimensionally. So I cannot really. I'm sorry. English is not my native language. I'm from Japan, so please
yeah.
understand my English. But it's
You're
really
doing
difficult
amazing.
to explain everything by statement. So I try to draw the picture and I try to make her understand what is really going on. So that's why my consultation time is very important to my patient, because I can really explain my insight before going to the laparoscopy, what I can detect, what I can see, and what is likely. So I can kind of strategize how to help her during my haptic excision laparoscopy.
Makes
So
sense.
that's my approach.
Yeah. So what happened after that, Carissa?
Yeah. Well, through that, I learned a lot. My uterus was, and Dr. Kanayama, you'll probably know more than
Yeah.
I do,
Yeah.
but it was
So it's like this way.
twisted. Yeah, right. Yeah, that's what he did.
So it's about 45 degrees to the left and also another 45 degrees to the back.
Yeah.
Yeah.
I think you described it like a twisted ice cream, like backwards, right? And my ovaries were attached to my uterus.
Right.
There was a pocket visible of endotoxic fluid.
Mm-hmm.
And there was also a cyst. There was a chocolate. It ended up being a chocolate cyst on one of my ovaries.
Yes.
Um,
Yes.
yeah, and I had not heard of, I didn't know that endometriosis produced its own toxins. And one of the first things Dr. Kanayama said to me before any exam, just talking, was that my acne looked like endo. And I had been going to an esthetician in town, and she kept saying, this is something internal. And I've tried, every diet, everything possible, and every skincare on top possible. And so for him to just immediately say, that looks like endo, I was like, I am finally in the right spot. He knows what's happening. So I had that consult on Monday. And then I think it was either Wednesday or Thursday, I had surgery that week. And then I had my follow up with him the following Monday. So within a week, I had consult, surgery, follow up. That surgery day was dramatically different. I walked into a room that was like nice and clean and had a window, which was nice, not any creepy lights hanging down. Every member of the staff was incredibly attentive. The anesthesiologist was amazing. He sang Dr. Kanayama's praises and has even sent his own daughters to Dr. Kanayama for excision surgery. And that just made me feel like I found the right. I was like, okay, if you send your own daughters as an anesthesiologist to this man, amazing. And I explained my medical conditions, and he actually had me position myself on the operating table so that there was not any pressure on any joints that would be causing me discomfort or lead to a subluxar dislocation later on. So everything was taken that seriously. My nausea afterwards was it was minimal, and I was not released until that was under control. I was able to go to the bathroom right away. And when I woke up, I said, it was shocking to me. I literally said, all my pain is gone.
Oh,
Like
amazing.
I'm in less pain now than I was ever, and I just had surgery. Like I couldn't, it felt too good to be true. I couldn't believe it. And I also kept bracing in the center of my abdomen, because I felt like I was so used to my organs being fused together there that my body kept trying to hold everything together. And then I would feel my muscles contracting, and I'm like, what am I doing? Like a crunch or something? Like what's happening? And I would tell them to relax, and I could. And my nurse was like, yeah, you don't have to do that anymore. Like your body, but if your body's gonna learn that, and then that night I was able to walk myself to the bathroom. I went on a light walk with a friend the next day. And sure enough, by day 5, I was back in New York for my post-op, and my husband and I walked around New York and we did a little shopping. And
Incredible.
that's insane to me. Yeah, it's absolutely crazy. There's one detail I forgot about my first surgery that I wanted to hit on because it's
Sure.
important and I think can segue to what Dr. Kanayama has to say. But when before you get surgery, they ask you, and what are you having done? Like they want to know that you know what's happening, and they're triple checking, I think, from my understanding. And so with my first surgery, I said excision of endometriosis because I believed I was having my endo excised, and I'm not a doctor, but to me, excision means to cut. I was unaware that I would be having ablation, that there would be any burning or, internal burning utilized to attack, to get rid of that endo. I had no idea. And so those were my exact words, excision of endometriosis. And I was so proud that I knew it because of all my research and, and then I said those same words with Dr. Kanayama, by this point, knowing the difference and knowing that it actually was excision and cold cut and not having any burning being utilized.
So good.
Yeah.
And what's been your journey like since then compared to, you were sick for months and months and months post-op the first time.
Yeah, it was like around like the 10-day mark. I was trying to like teach sessions again, and my clients were like, stop, go back to bed.
Yeah.
But like, but I had the presence of mind and the energy and feeling like myself and the lack of pain to think, I kind of want to do things again. I want to get back to where I want to get back to my life. And I would say by the 3-week mark, I was good to go. And then I had a 1-month follow-up with Dr. Kanayama. So I flew back about 1 month out. That all went great. My uterus was back in the right spot. My ovaries were not attached to it. No, nothing was attached. The endotoxic fluid was not there. My cysts were gone. And big difference there, my first pelvic exam with Dr. Kanayama, my friend held my hand because I would cry just being touched. It hurt that bad. And the second time I experienced a pelvic exam that had zero pain. Zero. Like, I didn't know they weren't supposed to hurt,
Wow, I love that.
Yeah.
That's such an incredible outcome, and I'm so happy that you got the treatment that you deserved and that everybody with endometriosis deserves. So I just want to invite Dr. K to chime in here to explain to us what just the factual differences about the technique that you use for excision versus what Carissa had initially.
So when Carissa came to me, she told me she had a stage 1 endo, and she told me it's supposed to be completely excised. So I was wondering what is really going on, but when I examined her, something is not right. My examination showing it is not the right anatomy, and everything is twisted together. So I know something is not right. And when I did my laparoscopy, stage 1 endometriosis, how many months later, Carissa, you came to me? 6 months? Well, 7 months.
6 to 7, maybe 6.5.
6 to 7 months. Yeah. So I was expecting stage 1, so almost all of endo is gone. Only very microscopic endometriosis I might need to find out. But what I found out was stage 1 endo becomes stage 3. So it's spreading all over her pelvic area. And Carissa also showed me a picture of first robotic surgery, pelvic cavity. Then there's no scar tissue, no adhesions. But when I enter inside, there's 3 separate layers of adhesions, which is connecting uterus to her ovary and intestine to her backside of the uterus. And I don't remember exact count, but we discovered more than 50, 60, 70 different spots of endometriosis. And I removed all of the endometriosis. Then I have a pathology report. Pathology report show everything came back endometriosis. So, so this is one of the example. I fix the Da Vinci robot patient right now almost every week, and I am seeing Da Vinci robot case after the Da Vinci robot. So many hidden deep endo is completely missed.
Hidden
And
and
so,
endo, did you say?
yes, yes. So it's kind of like a very difficult subject to explain in a short period of time. But the major difference is my surgery. I can feel it's called haptic technique. Haptic means touch of my finger. So, for example, I have a face right here. So if you look at my face, if you push me here, this is soft, and this is my cheek. This is still my cheek. But once I get to here, I can feel my bone.
Yeah.
So yeah, so you understand me? So even though look like a completely same skin, but soft, then now it's bone. So this is a haptic technique. Haptic means your surgeon is able to feel the texture of endometriosis and texture of normal tissue.
Right.
So endo tissue and normal tissue is completely different. And so many endo, like a Carissa's case and many deep endometriosis case, their endo is completely hidden underground. You understand me? So it is all completely hidden. So in order to find the endo, you really need to feel every texture of the tissue, and your surgeon need to know very delicate difference between fibrotic endometriosis, endocore, and non-fibrotic normal tissue. These three areas are, quite different. So that is how I apply my technique, and I cut to the root of the disease.
Right.
So haptic skill really make me to detect the endo. So haptic skill, endo is more like you have to think more like a deep water fishing. So when you go to ocean fishing, you throw the bait.
Yeah.
Then you don't see the fish. But when you throw the bait, fish catch your bait, then they pull the string. Then you can tell fish is down there. So deep endometriosis excision is just like this. You really need to feel the tissue to detect deepest root of the disease.
You
So
can't
that is
see the fish.
that is my haptic excision. And what Carissa have in the first surgery is Da Vinci robot. So Da Vinci robot, unfortunately, surgeon cannot feel anything. Surgeon is far away in the corner of the operating room, and he's watching her inside, and he's moving his hand without touching anything. So that is a major difference. People need to understand very delicate excision of endometriosis to really excise to the deepest root of the disease. Haptic skill is so important.
Yes. And so
I
when
don't know, that
you
makes
use
sense
the
to you?
haptic, yes, it definitely does make sense. So when you use that technique, doctor, is there any burning involved at all?
No, I don't use any. Another difference is I use my own scissors, which is called cut. And the Da Vinci robot, they use monopolar scissors. And monopolar scissors is actually causing burning. Each time they cut, they causing a burning. So Carissa's inside, after Da Vinci robot surgery, so many new layers of adhesion develop. And that is very typical of how to say in English. I can tell the difference scar tissue caused by endometriosis.
Right.
And also scar tissue caused by non-Da Vinci type of surgery. But there's very specific type of scar tissue. It is created by Da Vinci robot. It's going to be multi-layer sticky tissue.
So you can see that when you go in.
Right.
What do you think happened between the initial diagnosis, where she was diagnosed with stage 1, surgery, to meeting you when she had the fused organs, essentially? and stage 3, what do you think happened? It just obviously something happened which caused it to spread and to stick.
Yes, so I also saw the splashing effect of endometriosis. So when burning scissor touch the endo, what's happening? They're gonna splash.
Splash.
So making many tiny particles spread up in the air, and it's gonna be spread into the normal tissue. So patient can get better for 1 month, 2 months, but 3 or 4 months, this splash endo start to grow. So that's what happened to Carissa's case. The stage 1 becomes stage 3 in 6 to 7 months, right?
And I think it's really important that when you do go in for surgery, you need to ask these questions about what surgical technique.
Yes.
And it's up to you to decide.
Yes, but the patient, I think it is so important because of most patient doesn't really know because of so much advertisement done in this country or United States. I don't know about Australia, but so much like a promotion money, advertisement money of promoting damage robot for endometriosis. And but they never tell you that Vinci robot is no haptic, zero, or no haptic at all. No robotic surgeon really tell you this. So I think patients need to be educated, and that is the reason why I created my Instagram. Because of my Instagram, originally I'm creating my Instagram not to recruit my patients. I'm already very busy. I don't need to recruit. But I decided to create my Instagram because of to teach people, and to teach people and teach the fact. Fact is so important. So lack of knowledge can kind of make you, vulnerable to any type of deception. But if you really educated, know the truth, know the exact detail, you can wisely have an informed consent, and you can wisely decide what is best for you.
Yeah. So informed.
That is where I'm coming from. Right.
Yeah. We do have a few questions here, and I'm just going to start reading them off because time is ticking. The question here from Danielle, she's asking about what you think of. Okay, so what do you think of the medicine that's hitting the market in Australia for endo? It's called medroxyprogesterone acetate, or MPA. I just want to chime in here. It's just a progestin, so it's just another form of the oral contraceptive pill. So it's nothing new as such in the way that it works. It literally just suppresses your normal menstrual cycles. So again, the pill isn't. If it's going to be something that you use as a band-aid, it's probably still a really good idea that you opt for proper surgery. And of course, being a naturopath myself, the pill is not a fix. The pill may slow the progression of disease, but it doesn't stop the progression of disease. And you need to bear in mind your fertility goals as well. So yes, just because it's newly listed for endo, it's nothing new in terms of the mechanism of the drug.
Yeah, you are right. It's not really new. It's just like in a different package.
Yeah.
And so you need to remember, no medication remove endometriosis from your body. So I think it is very important if you have a, stage 1 to stage 4, any type of endometriosis, endo need to be removed from your body, from the root of the disease. Then you can start resetting process. You can restart your life. You can restore your life. But the endo need to be removed.
And I love it.
And the endo is also, we need to understand, endo is not the same as endometrial tissue. It's different. And so if you can study my Instagram, I share the information. Endometriosis produces its own estrogen. And endometriosis is also resistant to progesterone effect. So it is not the same as endometrial tissue. So you have to think about endometriosis more like an independent factory.
Yes, with many different underlying drivers.
Right, exactly. Yes.
Simply
cancer, but it's behave like a cancer in a way.
Yeah, so simply suppressing your menstrual cycle is a band-aid for it. But if it's the
Right.
thing that you need to get from step one, and this is what I say to my ladies, if it's the thing that you need to regain some quality of life, to give you the momentum to then get back on your feet, to get properly treated, then it's something you can do in the interim. So yeah, it's not a new medication. It is another form of a synthetic progestin, which I always say to my ladies is different to your own progesterone that you make. Another question for you, Dr. K. How long is surgery typically, and are multiple patients booked in for excision on the same day, or do you only handle one case per day? And also, do you collaborate with gastrointestinal surgeons for cases that have bowel adhesions?
Yes, I do. And I do collaborate with some colorectal surgeons. And answer to the first portion of the question, depends on how difficult endo case is. So endo cases, you cannot compare stage 1 to stage 4. So stage 1 is this level, and stage 2, 3, 4, and depends on how much, what type of stage 4. If patients have a bilateral ovarian chocolate cyst, if patients have a frozen pelvis, patients have a deep nodular infiltrating endometriosis. So my surgery time, usually I will spend enough time to investigate everything. So I will spend at least 1 hour from up to the diaphragm and down to your anus area. So first portion of my surgery is a very close investigation and inspection of every part of the body I can see from the laparoscopy. So I will say my surgery will last somewhere between 1 hour to most difficult case 7 hours.
Wow.
Yeah. And so I can kind of estimate how big each surgery is. So if it is really big surgery, I can only book for 1 case a day. And the medium surgery case, I do 3 cases a day, sometimes 4 cases. So it depends on my estimate. And but again, I take my time. So once I do my surgery, I don't watch the clock. And, until everything is finished, I never stop.
Yes, and we just have some lovely messages from some ladies here that are saying, best doctor on this planet, and someone's just saying that someone's just conceived naturally after haptic excision with you, which is amazing. I'm sure you get lots of those like miracle cases where endo wasn't actually removed properly, and then they can conceive once it is removed properly, which is incredible. Someone's actually getting surgery tomorrow, which is
yes.
Yes, someone here.
She's also from Texas.
How exciting. Someone is saying, I went through pretty much the same thing last year and had my 3rd surgery where they removed my entire left side, part of uterus and appendix. And on my 3rd surgery, the endo specialist did the Da Vinci robot. She diagnosed me with DIE, deep infiltrating endo, because it spread everywhere. I'm always in pain and it feels like it did nothing for me, and cysts came back and grew bigger. They want to do a hysterectomy. I said no and wanted to know what your experiences is with DIE. My endo is spreading fast and everywhere. It's impossible to find a haptic, I think you mean haptic surgeon here in California. They gave me a strongest dose of Orlissa. I read about it and stopped taking it 2 months ago. Could I know more about that as well as your reasonings for Orlissa not helping? So
Orlissa is bad medicine for endometriosis. I never give Orlissa to anybody. Like Lupron.
Like Lupron.
Yes. So Orlissa is kind of like a pure form of the Lupron, put you to menopause, and they're not going to touch your endometriosis and give you so much side effect. So I do not recommend Lupron or Orlissa to any one of my patients. And for the DIE endometriosis, it's really important. That's where between haptic and Da Vinci robot makes big difference. Biggest difference is DIE. Because of deep nodular endometriosis, almost like 90% of the endometriosis is underground. It's completely hidden. So if I use Da Vinci robot, no matter how much experience I had before, my surgery become imagination surgery. I am guessing, I am imagining in my head how this feel like, because I cannot touch. So I am cutting with guessing, and when I am cutting, I cannot feel any tissue. So everything is like, if my imagination is correct, I can do the good surgery. But if my imagination is totally off, I miss endo, I leave endo, and plus I burn by my scissors. So that's another, comment I want to make. And hysterectomy is not going to work for endometriosis. As I told you, endometriosis is different from endometrial tissue. So removing the uterus not gonna touch your endometriosis deep inside, deep nodular endo all over your body. So endometriosis need to be specifically addressed to each endo, to the root of the disease. And your surgeon needs to be meticulous enough to pick up every tiny endo to the pinpoint size.
Wow.
And this requires experience, dedication, and determination. And also you need a strategy. You need to strategize how to attack each endo. Each patient is so different.
Yeah.
Right.
Thank you.
So you need to find a good surgeon.
Yeah.
Surgeon.
Or
Yes.
come to New York.
Come to New York, yes.
What percentage of your cases are stage 3? It seems like a lot of your patients are, from my research, considered stage 3. Also, why do you think doctors charge so much for short virtual appointments with a specialist when seeking care?
What percentage of my patients are stage 3? I will say I don't count exact number, but I have a stage 1, stage 2. If I combine stage 1 and 2, probably about 20% of my patients is stage 1 and 2. And rest of the patients, I have about close to 40% of my patients stage 4, DIE.
Wow.
And so usually my patient came to me after already diagnosed by other doctor, and the patient came to me after they have done Da Vinci robot or ablation surgery, and their pain is getting worse. So these are the people, they came to me, and their endo is already getting pretty, advanced stage.
I'm not sure. If
And other question, I don't know how expensive and how other, the
virtual appointments, short
virtual appointment. So that's I don't really know like how these are charged and so forth, but I do charge for some money for the virtual appointment. And because of all of the reviewing the medical chart and giving my professional opinions. So it's not free, yes.
Yeah.
I don't know if I answered the questions. Yeah.
Yeah. Would you still recommend excision surgery if a patient does not have very painful or extensive symptoms? Recently discovered I have endo from surgical report. I haven't seen doctor yet, so I don't know stage yet, but I have adhesions and frozen pelvis. It's interesting how he had that, but it wasn't excised. So it was diagnosed but not removed. Sounds like it.
How she was diagnosed?
No, it just says, recently discovered I have endo from surgical report. I haven't seen doctor yet, so I don't know stage yet, but I have adhesions and a frozen pelvis. Would you still recommend excision if a patient does not have very painful or extensive symptoms? So I assume she has discovered she's got endo, doesn't know the stage yet, but isn't very symptomatic.
Every endo patient is so different. So I cannot give you my advice based on this information. I need to examine the patient. I need to examine, and I need to really interview full history. Then I can give her my best advice. For the frozen pelvis, and once endo become really advanced stage 4 frozen pelvis, endo patient body become numb. So So they may not feel much more pain, but the endometriosis is still progressing inside, and they are slowly attacking many different organs.
Mm-hmm.
So pain is not only factor, but you need to take a look at the entire picture.
Yeah. And can I just chime in with one thing there? It should also depend on the patient's fertility goals as well, because even though you may not be symptomatic, endo and fertility issues go hand in hand quite closely together, and difficulty conceiving might be your only symptom. So keep in mind your fertility goals too.
Yes, yes. So endometriosis and fertility is also a very interesting topic. And the reason why many patients on me become pregnant naturally, even after failed IVF. I have a couple of patients, they have 3 failed IVF, and they become pregnant naturally after my haptic excision. Because of endometriosis really affects the fertility by many different ways, including toxic effect. So endo need to be removed to the root of the disease, and your body need to be detoxified from the process of the endometriosis. Then your body become much more baby friendly to carry the baby instead of miscarriage or infertility, and many miracle happens. So that's my idea.
Yes, I love that. I love hearing that from a surgeon, because obviously from a naturopathic medicine perspective, you know, with inflammation, with excess hormone production from the tissue itself, and as you said, Carissa, Dr. K said, oh, the endo is creating toxicity in your body. And it's so true with that level of inflammation. There's so much benefit in literally removing the source of that inflammation. You just feel like a different person. We've also got some amazing messages here from people who just want to express their thanks to you and their love to you, Dr. K, for all the work that you do.
Thank you.
And there was a message from Nicole, whose sister had successful surgery and is finally able to work. She had multiple botched surgeries due to the Da Vinci method, and she didn't think that the quality of life would be possible. So very, very grateful. And yeah, I don't know how much more we can do, but maybe just a couple more, if that's okay with you with time. Is that all right?
Yes, if time is permitted, yes.
We're all right? Okay. Hi, Dr. K. I started developing multiple pseudocysts after a bilateral ovarian endometrioma cystectomy. Is this normal? My doctor says it's harmless, but it's affecting my bowel movements. Is there a way to prevent recurrence?
I don't understand what she means by pseudocyst.
And if something is affecting her bowels post-op, it's probably not harmless.
I need to see the picture of ultrasound.
Yeah.
Yes, because of each case is so different. So I need more information to answer to our questions, which means more detail. Like, because pseudocyst means I'm not sure what she's talking about. Pseudocyst, like a regular simple cyst, or something pseudo chocolate cyst, or what type of cyst, she is talking about.
Yes, yeah.
Right. So if she ask me questions, maybe she can DM me, she can send me more information, then I can offer better opinion.
Yeah.
With more detail. Yes, because I don't want to guess.
Yeah, that's a good idea. Right. I love this question because I know that you're the expert. Can you address adenomyosis with the haptic technique?
Yes. So adenomyosis is another area. It is impossible to save uterus, especially diffuse adenomyosis. Adenomyosis like diffuse everywhere inside the uterus, and only way you can really find adenomyosis is need to feel the texture of the disease. Adeno feel totally different texture from the normal muscular uterine muscle. So by using my haptic technique, I was able to feel like this is my hand right here. So again, I'm gonna use analogy of here is my bone, this is soft tissue. So by sensitively touching this area, I can detect this is adenomyosis, this is adenomyosis. So that is type of technique I developed over last 20 years. And so I developed my own technique, how to save uterus from adenomyosis. So even diffuse severe adenomyosis, sometimes I take out 250 pieces of adenomyosis from one uterus. Then
Wow.
still save the uterus, and that patient become pregnant, and she deliver a baby. So this is like a miracle, but you can do this.
It's
so
incredible.
there's hope for the adenomyosis patient. You need to find a haptic doctor to save your uterus.
Wow, and that's not something very common because conventionally all you hear is that you need to get a hysterectomy if you have adenoma.
Correct, yes. But that's no longer truth. You can save your uterus from adenomyosis.
Yeah.
So you have all, yes.
Yeah. All right. How many more questions do you want to do? There are quite a few here. How much time do we have? Maybe two more?
Yeah, sure. Okay, yes.
Two more. Does
But
excision?
remember, not all questions I can answer completely because I need more information.
Yes. Okay. Does excision help improve severely heavy periods, meaning having to change ultra-sized tampons every hour for the first 2.5 to 3 days? I see very heavy periods, and I think adeno straight away. Adenomyosis.
Yeah.
So if you
Yes.
So excision.
But endometriosis also causes heavy period.
Yeah.
So it's not only adeno. I saw so many patients without any adeno heavy period. They have stage 2, stage 3, or stage 4, even stage 1 endo. But after I completely remove endometriosis to the root of the disease, their heavy period stop. Because after surgery, first 2 to 3 period is heavy. That's normal because of your uterus is detoxifying. And but after 2 to 3 period, this patient's previous heavy period go back to normal. So I am also witnessing so many patients like this. So endometriosis easily cause heavy period. Please remember this.
Yes, absolutely. And if they have not had if they know they have endo and they don't know they have adeno, it's an additional possibility because that was my case. There was everyone suspected endo, the surgeon suspected endo, but when we went in, I had a very, very bulky adenomyotic uterus, and that explains a lot of the other symptoms. But yes, absolutely, excision. And just to geek out a little bit on like the pathways, as Dr. K mentioned earlier, endo can make its own hormones, so especially estrogen. So if you're in a state of estrogen to progesterone ratios are out of whack and your estrogen levels are too high, it may not even, on a normal blood test, your estrogen levels may be normal, but in terms of like the ratios and the way you're metabolizing that, and we can test that with something called a Dutch test, if you're in this state of estrogen dominance, you think about it, which is produced by this excess, by the tissue, the endo tissue, once you remove that, that significantly reduces that, and hopefully your ratios can go back into a healthier range. So when you're estrogen dominant, heavier and more painful periods for sure. So yes. All right, one more question. Does consult and excision have to be scheduled at a certain time in the cycle? If yes, during what phase or day range of your menstrual cycle?
Consultation, I can do consultation during the period. And so doesn't need to, if you want me to do the pap smear, of course, I cannot do during the period. But I usually don't do pap smear because it's going to be done by regular OBGYN. So they come to me for the examination of the endometriosis and, find a solution for the endometriosis. So, so I prefer not during the period, but even during the period, I can examine my patient and I can give my advice. Right. And for surgery wise, usually I can book the surgery after the period and up to the ovulation time.
Okay.
So, but doesn't need to be that timing. I can still do after the ovulation.
Okay. So first part of your menstrual cycle is the optimal time. Your luteal phase, or the time between your ovulation and your period, is still okay and can be done.
Yes. Because what is most important is my hand and my eye. So no matter what type of cycle, literally what I'm gonna do is because my hand is holding my camera. In Da Vinci robot, machine is holding the camera, but I'm holding the camera. I can move my camera many different directions within 1 second. So this is the skill I'm talking about. Da Vinci robot, it is fixed this position, and they can do zoom in, zoom out, and very slowly move. But in order to detect very tiny endometriosis, almost pinpoint, I need to bring my camera almost like a near contact level. So it's so magnified, then I can see many different angles, then I can touch. And that is my technique. I can detect many hidden endometriosis. And so during the period, outside the period, it doesn't really change too much, my technique wise.
Yeah, so it's not a prerequisite,
right?
Be at a certain point in your cycle.
I can do the same job. Yes.
Amazing, just incredible work. I think that everyone here would agree that you're definitely one of a kind in your field, and you've really mastered this technique. And my only hope is that more women can have access, more endo patients can have access to surgeons with this skill, and that more surgeons can be trained in haptic, because it looks like there's definitely, is it phasing out? Like, are more people just gravitating towards the robot route in terms of surgical preference, because it's, I don't know.
It's easy, it's like a video game.
Yeah.
So you don't need to have a much, manual skill, but robots can move around.
Yeah, and
but important. I really wish more surgeons stop using robot. Then they need to be honest. They need to be frank and honest to the patient. Then they can learn the haptic skill and they can help the endo patients.
Yeah.
Because my loyalty, I don't have any political tie, I don't have any association, and I only care for my patient. My tie is all endo patients, endo sisters.
Yeah.
So I will speak up and I will tell what is best for endo patients.
Which everyone's so appreciative of, because we know that there isn't any censorship, there's transparency, and it means so much when we're bombarded with information from here, there, and everywhere. We don't know what the motive is behind that. So just thank you so much for that transparency, I guess. And yeah, we do have a lot of questions, but unfortunately we've run out of time. That's flown by. It's been such an incredible talk. Carissa, thank you so much for sharing your experience. Dr. K, thank you for your time. I don't know if you guys know me, if you are Dr. K's patients, or you came on through Carissa's Instagram or my Instagram, and I realized I never really properly introduced myself at the beginning, but I'm a naturopath and clinical nutritionist. I have an endo and adeno. I was symptomatic from the age of 11. It took me 12 years to get a diagnosis. I got one proper haptic excision surgery by one of the best surgeons at the time here in Australia. So I'm based in Australia. My husband's Australian. And I did not opt for the Mirena. I was presented the option to get a Mirena inserted at surgery if endo was found. I said no. He said, I'll give you 6 months. I said, okay, I'm up for the challenge. I delved straight into the world of endo. I'm a naturopath and clinical nutritionist, so worked on it holistically, worked with a traditional Chinese medicine doctor as well, did acupuncture, Chinese herbs, everything I could do, and became pregnant within 6 months with my first son. I now have 3 wild, beautiful boys.
Wow, congratulations. Great.
Thank you. And I am extremely passionate about this route of getting proper surgery and then doing everything you can through diet, through lifestyle, through herbal nutritional medicine to prevent recurrence, because I do believe that as endo patients, we have tools and can be empowered to make the decisions in our day-to-day life to which we know affect the underlying drivers of endo. I'm not implying causation, but the underlying drivers we know are hormonal drivers, immunological drivers, inflammation, and there's lots of really interesting research coming out with the microbiome, so your immune function rooted in your gut. I know that there was talk on this at the Endometriosis Summit, where your gut microbiome plays a role in your whole body's immune system and inflammation. So that's the naturopathic approach really that I have used over the last decade or so, and I am completely hormone and drug free. And I am, yeah, it's almost like a full-time job managing endo. And Carissa, I think you agree.
100%,
But
yes.
it is possible. It is possible. And I was speaking to an audience yesterday, and I said it is hard. It was a much more naturopathically inclined discussion, but it is hard. But it's not like the default conventional path is easy for us anyway. Most of us have been stuck on this cycle of being dismissed, not being heard for years and years and years. And in Australia, the average time for diagnosis is approximately 7 years, and I think it's quite similar in the States. So it's just about the path that you want to choose. Someone has asked whether you can cure endo belly without surgery. I believe you can, because there is a strong gastrointestinal link to that too. You need to find out, if there are gastrointestinal causes to that bloating. Of course, it's always better to get excision surgery, and as Dr. K says, start your new life, your reset. And so I'm extremely, extremely passionate about that. But Carissa and Dr. K, if you have anything else to add, please feel free. But thank you so much, everybody, for joining in.
Yeah, I do have one little tidbit. I just wanted to kind of hit on like online groups like a little bit. I think that there are a lot of communities out there that have really good intentions. And also those communities led me to places that were not helpful and caused harm. And when I tried to go back to those places and say, hey, here's my medical records, this is one of your top recommended surgeons, can I share any of this? And even like a watered down version, like just minimally. I was not allowed to. And so when you go to groups and you see really raving reviews from their surgeons, I think it's just good to know that you're seeing only good ones, because they're not, like, people are being silenced. And so when you're in a self-advocacy situation, I think transparency is really important. And so just from my knowing on the back end, that transparency in self-advocacy groups is not a guarantee, that there are lots of ties and people with other interests, unlike Dr. Kanayama. And so I also felt so empowered by those groups to make the decision that I almost didn't go to Dr. Kanayama when my friend said, hey, Da Vinci's not the way to go. In my head, I knew all the rebuttal answers to what she was saying, because I thought everything I had spent so much time researching was the only answer. I'm so glad I didn't listen to those things, and that I bit my tongue. I knew she was right deep down, but it was really hard to admit that all the information I had been fed and all the research that I had found online that is part of a bigger problem and system in general, that's what we have to do, right? But to admit that that might not be the truth and then find something else, it's hard. It's a hard pill to swallow. Like, oh, that didn't lead me to the right place. I have to do more research again. I have to go to somebody else. So yeah, just wanted to like put a little note in there that there's so much information. It can feel really overwhelming, and it's really hard when you feel like you have to be your own doctor and your own researcher, and also when you have brain fog and fatigue and you're in pain. Like, it's just really hard. And so zero judgment to anyone who has been in a similar situation, and also just to know that a lot of those groups, just to be cautious and know that there's other information outside of those.
Yes, be discerning, get a good team of people that you can trust, whether that be your surgeon, your complementary and alternative medicine practitioner, your pelvic floor physiotherapist, whoever it is, and I think that's the best way of going about it. So yes, Dr. K, was there anything else you wanted to add?
Just one comment. So your education is so important. You need to know detail. You need to know the fact. And so that's why I created my Instagram. And so try to teach you, try to share information, try to share my experience, and try to share the fact. And so please study, please educate yourself, please be smart, and please have a discerning mind.
Yes.
Okay? And that will protect your body. Then, after you have a lot of correct information, education, you can choose wisely what is best for you.
Yeah.
And that's a kind of I'm not lecturing or anything, but I am encouraging you to be educated, please.
Yes. Yeah.
For your own benefit. Yes.
Yes. Our bodies are precious. That's for sure.
Yes.
Yeah.
Yes.
No. Well, thank you everybody for your time today. Carissa, thank you so much for being, vulnerable, sharing your story with us. It's really, it's blessed me. And Dr. K, thank you so much for your time. And I'm so sorry, we have had lots of questions. I wasn't able to get through them all, but if you've got any,
maybe a different timing. Maybe we can answer
perhaps
question
part two.
in separate occasions. Yes.
Yes. But if you've got any naturopathic questions, you can DM me. If you've got any additional questions for Dr. K, as he mentioned earlier, you can get in touch with him
DM me.
over Instagram. Thank you so much, everyone. Have a good rest of the day or evening wherever you are, and happy Endometriosis Awareness Month.
Yes, happy March. Thank you.